Hi, my name is Khalid Sharif. I'm a consultant orthopedic surgeon with an interest in sports surgery. And today I want to do another video for my athletes on a common injury, which is ACL tears. I'll talk first about the anatomy, then we'll go on to talk about the who gets it, the presentation, how to prevent it, and then the surgical and non-surgical options and when you should get the surgery. So let's dive in. So the ACL is an important stabilizing ligament of the knee. There are two cruciate ligaments, the ACL and the PCL. The ACL prevents the tibia going forward on the femur, and the PCL does the opposite function. They also have a function in rotation and in pivoting. So who gets these injuries? Mainly athletes, skiers, jumpers, footballers, rugby players. And the mechanism is when you pivot on a planted foot. So when you twist suddenly on a planted foot, this is the mechanism of the injury. And the athlete would get immediate pain, a pop, immediate ballooning of the knee, which is much more profound than when the same mechanism produces a meniscal tear. The signs would be a positive Lachman test, an anterior draw test, and a pivot shift test. Orthopedic surgeons can diagnose this clinically. However, the diagnosis is clinched with an MRI scan, which is the gold standard, and that can differentiate between a partial tear and a complete tear. The prevention really is you have to prepare yourself for the athletic activity in terms of proper workout, improving the strength of your quadriceps, your hamstring, warm up, proper footwear, and proper technique. All plays a role in preventing this injury. The treatment options, there are non-surgical and surgical. The partial tears really don't require surgery. Most patients, depends on the degree of tear, and that can be diagnosed, that can be through clinical and through the MRI scan, but patients with a partial tear can undergo physiotherapy and some rehabilitation, go back to their athletic activity. However, those with a complete tear and an unstable knee need to have their ACL replaced. The reason being is I did lots of study on these ACL tears at the time when the waiting list in the NHS was very long, and we scoped the knee at the time of the tear and scoped it again at the time of the reconstruction some 12 months later, and there was marked progression in the meniscal injuries and the chondral surface injuries to the cartilage of the knee. So the surgical options are you get a graft, and this graft can be either a synthetic graft, which includes a suffix, carbon fiber, or Lars ligament, and they don't do as well. But the important thing is both these and the cadaveric graft, where the ACL is taken from a donor, they avoid an important complication in the autograft, which is the donor site morbidity. Now, when you come for a consultation, you will get usually an autograft offered, and that's taken from your hamstring, the patella tendon, or the quadriceps. When should you get this? The surgery can be done arthroscopically or open. Mostly we do this arthroscopically now. When should you get the surgery? I advise patients and athletes to have a prehabilitation period of about 6 weeks to 2 months. The reason being there's been a lot of evidence to show that these patients that have this prehabilitation in terms of physiotherapy, improving their range of motion, strength, and stability, do much better than those that did not. But I warn them that they should not undergo any, should not partake in any sporting activity during that period until they have their ACL reconstructed. The other mention I want to, the other thing I want to mention is basically the repair. You may hear about repair, and that involves a collagen scaffold where they impregnate it with the patient's own blood and they wait for the ACL to heal. That has been tried in the clinical settings, and the initial results are good. However, the long-term results are not so obvious at the moment and still in the study phase. Therefore, I advise all patients and athletes who have a complete ACL tear and an unstable knee, if they want to go back to their athletic activity, to have their ACL reconstructed. The ones that don't have the surgery are either they don't want to go back to their athletic activity, they're sedentary type athletes, or they're unfit for the surgery. Then they can do some physiotherapy, use a brace, and so on. So I hope this is helpful.